this topic became very popular throughout this year. So we decided to tailor these webinars specifically for those who want to learn from scratch what is dental shells, how you can apply that in your practice, and how you can create that in your practice using this MIFI software. So for those who are new here and do not know what MIFI is a software available on App Store where you can deliver smile simulations in 2D and also 3D dental mockups and treatment plan your patients digitally using your iPhone, your iPad, and your MacBook. Everything is connected, which means that you are able to upload the patient's files, such as intraoral scan and photographs, design and do everything in the palm of your hands, and then export it by sending it to your 3D printer of preference or outsourcing it to your lab for them to 3D print. So that's why we call it the software for the modern dentists. It's the software that will allow you to do better workflows in your practice because you are using this technology to your advantage. It's not like you are doing everything digitally. You will still have to do some analog work because as dentists, we work in an analog environment, but you will use this digital software and the digital technology to make your workflow just simpler and simpler to communicate with your patient. So to begin our workflow with dental shells, it's important for me to talk about the backward treatment plan. What does that mean? I'm pretty sure that, if you have a very busy practice, you know that sometimes we are running around and the patient comes in and they usually know what they want to do with their mouth, with their issues. We just focus on that. Usually the patient is not fully involved in the visual prospect of what you are planning to the patient. And by the end of the day, the patient is only aware of what's actually happening towards the end of the treatment, even though you already sent a paper and a written version of the treatment plan to your patient. But when we come with the backward treatment plan, instead of focusing only on the patient's problems, main problems, and only on that one treatment that we are proposing to our patient, we are also focusing on an overall type of treatment plan, a more complete treatment plan where we involve multidisciplinary specialties in our dental practice to deliver what is best for our patients. I was talking to one of my colleagues here the other day, and we see a lot of static treatments coming in dentistry right now, especially because of social media. And a lot of times, the doctors, they tend to just make the teeth prettier, but without thinking on how to make the whole base of that treatment more stable, to make that static more reliable and make it more sustainable throughout the years. So when you perform what we call the backward treatment plan, you do start with the final aesthetic result in mind, but you are also making a roadmap where you fully understand how to get into that final aesthetic result. So the workflow that we do, we begin our treatment plan by creating a clinical exam, which is what you are accustomed to do. Along with that, you also collect the patient's complementary exams, such as the intraoral scan, x-rays, CT scans, to then begin these facially driven backward treatment plan. What does that mean? It means that along with everything that you find in your patient's oral structures and with the complementary exams, you also add the patient's facial components to deliver a more harmonious aesthetic outcome to your patient. And not only that, you also deliver to your patient a more assertive treatment plan, making them to participate in this treatment. So by collecting all these informations, you can upload that into this software called SmileFy to help you deliver the treatment that you want to propose to your patient. It just becomes simpler for you to also treatment plan your patient because you're doing everything before you actually perform the treatment. With the patient's files, you are able to select the best teeth shape, the best the patient's face. You're able to do some facial and dental analytics and use the smile frame to deliver the patient's proper smile curvature, proper lengthening, proper proportions of that restorations that you are proposing. With that, you're able to deliver a 3D mock-up trial. And with the 3D mock-up trial, which is the main topic that we will be discussing here today, we are able to show the patient a before and after before we actually start the treatment. And that mock-up can become a guide for our minimally invasive restorative treatment, to our gum contouring guide, or to our veneer restorations, or any other type of procedure that we are proposing to our patient. So in the next 40 minutes, I will show you how you can use this technology to increase this conversation, increase the communication and the way that you communicate with your patient in an easier way through visual communication, and also how to use this system to help you treatment plan your cases to have more assertive final outcomes. For when it comes to the dental walk-ups, we know that there are many ways of doing that. That's not something new in the dental field. Starting with the traditional mock-ups, you can simply take a mouth impression or scan the patient's mouth and then send it to the lab for them to do these mock-up trials. But the problem here is that most likely it will take you 5, 10, sometimes 2 weeks to receive this walk-up back to your office, and it's very costly. Most likely there is not a lot of facial references. Even if you send a couple of pictures to your lab, the lab kind of like is on its own trying to match and have the best teeth design to give to you so you can do a smile trial in your patient's mouth. Then we have here the SmileFy 3D mockups, which allows you to perform your dental walk-ups in a couple of minutes in your office using your iPad, iPhone, or MacBook, where you will upload the patient's photograph and the patient's intraoral scan to then find the best teeth shape to then print and perform the mock-up using a silicone key and a bisacryl. This is a great option, of course, but it also gives you the chance to spend more resin when you are printing the models, and also makes the workflow a little bit longer because you are also create the silicone key and you have to also purchase the bisacryl. When it comes to creating the regular dental wax-up, I personally like to use that when I want to perform a procedure, such as using the model to create my prep guides, or use the model to use my silicone key for injectable composite restorations, for example. But if you are in that stage where you are pre-planning your cases, where you want to bring your patients into the treatment and preview the patient the final outcome prior to beginning the treatment, SmileFy Shell Mockup can be a great solution for you because it takes just a couple of minutes to create and just like a very few materials for you to print and perform in your patient's mouth. So talking about the SmileFy shells, the SmileFy shells design is a thin veneer type restoration that can be temporarily placed over the patient's teeth to preview their smile before the treatment is initiated. Well, but Dr. Diogo, what if I have a case where I'm doing, let's say, an additive case, an additive veneers, and I'm doing very minimum prep? Can I still use that veneers as a temp while I'm manufacturing the fine veneers? Yes, you can, because you will have some sort of space already, because you do the small prep, you have that small space, and then you can pop in some flowable composite or provisional cement and place it over the patient's mouth while you are manufacturing the finer restorations. So that's a yes question. Here, we will show you how you can use the shells for that pre-stage, all right? So the advantages of creating these shell mockups are that it's very fast to produce. And as I said it before, it has a very low cost. You use very little resin, but you need to find the right resin for that type of shells. There is no need to create the silicone putty to fabricate the matrix on the model. So that's another plus. And also, when you are 3D printing it, it just prints much faster if compared with 3D printing the full model. So if you have a 3D printer in your practice and your 3D printer prints models that are biocompatible, you can do it all in the same consultation. It takes about, depending on the printer, of course, but it takes about 30 minutes for you to 3D print. And for you to do the design prior to printing, it would take you another 15 minutes, depending on the case, even less than that. So if you have, let's say, a smile designer in your practice, or if you want to call the patient to return in the afternoon, you can definitely do that and already perform the smile trial in your practice during that same consultation or the same day. When you are manufacturing these dental shells, you need to make sure that your 3D printer is compatible with biocompatible resin that has a high mechanical resistance, because, you know, in case you want to pop that shell in the patient's mouth and then ask the patient to go home to come back maybe 1, 2, 3 days later, just to make sure that they feel comfortable with it, you need to make sure that that's also resistant so it doesn't break. When it comes to the shade, you also need to think about that. Formlabs, for just as an example, they have the Vita shade compatibility. So you can check from an A1, B1, A2 shades for you to print your dental shells. And you can also do the aesthetic finishing by applying some glaze, so it becomes more shiny, as you can see here in your screen. And you can also add some composite stains in case you want to fully customize your dental shells. So here is just like a summary for you guys to understand what dental shells are and what are the benefits of doing the dental shells in your practice, okay? Again, we have both types of dental wax-ups that you can create on SmileFy. One of them is by delivering the full mock-up with the design, where you can do a silicone stamped guide and place it over the patient's mouth using a bisacryl or pro temp. Or you can do the shell mock-up, which basically the workflow is almost the same, where you can create this very thin layer, 3D print with the right biocompatible resin and the right shade, and then of course characterized with glaze or composite stains. So on MIFI, what are the files that you need to create your dental shells? Like any other type of dental wax-up in MIFI, all you need is a patient's frontal smile and the patient's intraoral scan, upper and lower, okay? Of course, let's say if you are doing the shells, maybe you want to preview the smile with a treatment that also involves gingivectomy, osteotomy, and all that. You can also add more files into the software, such as the CT scan or other X-rays or other pictures from different angles that you can all do into SmileFy. But the minimum files that you need, it's a picture of a patient, which you can do it straight from your phone or using a DSLR camera, and the intraoral scan. So I'm going to share my screen here, and I will show you how it works. Okay, of course, this is a summary, and by the end of today's webinar, I want to give you guys, I want to actually talk to you about a little surprise that we are promoting here at the end of this webinar. But focusing here on the software, right now I'm using the Mac version, but the workflow works on all 3 devices, iPad, Mac, or iPhone. The first thing that you have to do is to calibrate the patient's files. Okay, you will set 3 points here on the STL and 3 points over the patient's picture, and then you hit calibrate. Automatically, the files will be calibrated together, which gives you the chance to deliver the facially generated treatment plan. Then once the files are calibrated, you will then begin the position of this teeth design, first from an occlusal view, and then from a frontal view and profile view. Over here, as you can see, we have what we call this Myify, and then this Myify can be fully customized using these buttons over here, where you can see position, rotation, height, Myify, midline, occlusal plane. And then you can visualize the patient's existing occlusal curvature from a frontal view and the patient's ideal occlusal curvature that you can predefine using this Myify. Then the next step will be already selecting the number of teeth that you want for your treatment plan. And then start your 3D design. So over here, right now, my files are just being loaded. Over here, I have here on the top left corner, a drop-down menu where I can find the type of workflow that I want for my case, where you can see here 3D design, which is for regular Walkups, mockups and shells, which is the one that we'll be selecting here. Also composite veneers, let's say you want to do for injectable composite, and implant bridge design. For today, we will start our workflow here by selecting mockup and shells. And then all we have to do is to follow the steps that we see here on the top. Over here, beginning with templates, there are several teeth templates that you can select and place them over the patient's smile automatically. You simply click in one of these teeth design here. Notice that we have triangular shapes, rectangular shapes, oval shapes, and that it's all done with just one click. Just by doing this teeth mounting, just imagine doing that with your dental lab. It would take you a very long time because one, you need to find the right time to do that with the dental technician. Then the technician needs to select the right teeth shape, the one that you like, the one that your patient likes. Over here, you can do it with your patient next to you, or you can do a Zoom call with your patient and show them the different teeth shapes, even before you 3D print them to do the smile trial. Or you can even do a couple of teeth designs here and print them all together and perform multiple designs, smile trials in your patient's mouth in that second visit. Then we move here to the next stage, which is the adjustments, right? So here we have rotation, we have position where you can bring in more distal, more mesial. We have size as well, where we can make the teeth slightly longer or slightly shorter. Notice over here that we have the same Walkup, but from different angles, which gives me the chance to check if I'm bringing this teeth too buccal, too lingual, or if it's rotated to the wrong position, and how to correct it. Then on my next stage, I come here into Smile analysis, and I can do the measurement of my teeth design. Notice that before we were talking here that the patient's teeth are very worn out, right? In this anterior segment, if I place the teeth here, I am able to see the patient's existing teeth with the intraoral scan and how much I am increasing to create proper smile curvature in this aesthetic zone. And I can simply get here my ruler, and I can check how much I'm increasing. I can also check full width, full height, which for me, it's crucial for have a better control of my aesthetic treatment plan. Even though this is just the beginning of my treatment, and I will still perform this Myify in my patient's mouth, I'm already having richer information to make more treatment more reliable, to have better legal documents in my practice, and to deliver more predictable final restorations to my patient. Let's say that I am placing this, I'm creating the shells, and then after I create the shells, I need to create my final veneers, but I don't have the CAD/CAM software to deliver these veneers. I can send all these informations to my lab. So now my lab can work with me and not just for me, which is totally different. Here, you are now involving the dental technician into a richer information and give them the right information, the right content, the right communication, so that you don't have to have the headache after the patient finalizes the case. Okay, so over here, with that, we are setting the patient's teeth proportions, teeth position, and we can also check on the patient's dental midline, facial midline, and also if the aesthetics, the parallelism of the patient's eyes and commissural lines are matching with the position of my central incisors here, for example. So even before you begin the restoration, you are now creating a workflow for your treatment plan. In the beginning of this webinar, I was talking to you guys. We are busy, and I know that. I'm also busy in the practice. But if we create a workflow where in every single treatment, we deliver a workflow, a digital workflow such as this one, I can guarantee you that the rest, the clinical part of the treatment will become much simpler. Because one, you are digitally planning your case, which means that you are getting familiar with every single detail of your patient's mouth already, of your patient's face already. And with that, you are automatically memorizing what needs to be done in the clinical setting. So over here, as you can see, I have already all the necessary information for my dental case. And now my almost ready stage will be, let me just maxilla here, okay, will be the final adjustments. What are the final adjustments? I want to make sure that the palatal area has proper coverage. I want to make sure that the gingival margin is fully marked. I want to make sure that the teeth are not overlapping to one another so that my dental shells look as close as possible to the final restorations. So when I open the Mesh editor, which is here, almost the last stage, it's just opening, you will notice that we will have now just the models. So over here, I can separate the upper and lower teeth. I can turn it around. For example, let me just bring this down a little bit. For example, for a shell mock-up, just like veneers, we need like a little hook, right, on the palatal area. So over here, I need to add a little bit of waxing. So I come here, inflate, tap on that tooth, and I will inflate just that area. And notice that now I'm covering that area. Same thing over here. All right, and as simple as that. Over here, as you can see, I have like a little excess of material, as you can see here in white. So I come here and flatten. And here I can remove all the excess. Same thing over here. Okay, it is important that when you are creating your dental shells, that you remove all the excess of that palatal area, because everything that you see here in white will be transformed into a dental shell. So if you have, for example, over here in this lateral, if you have all these excess, when you are going to place that onto the patient's teeth, this area itself might break or might make it more difficult for you to insert the dental shells over the patient's teeth. So over here, I go over here and I also remove the excess. On the canine, see over here, I actually need to add a little bit. So I come over here and I will add a little bit of it. For another tip that I can give you guys for dental shells, when you are 3D printing them, you need to make sure that they have very close contact points to one another. Otherwise, you will be 3D printing single shells, right? They will all come out separate, and that will make a little harder for you to place over the patient's teeth, okay? So make sure that you have enough contact point. You see over here, they are literally like touching each other. The contact point is a little bit more aggressive than a regular veneer. And the reason why, it's because dental shells, they will be printed all as a one file, so you can place them all together, okay? Just like a regular wax-up that you do with a bisacryl, you will do that the same thing here with the printed dental shells. So now that I have my dental shells, I can bring my lower STL back, and I want to make sure that they are not overlapping each other, the upper and lower teeth. I also want to make sure that the gingival margins are marked correctly, which they are, and if they are not, you can simply use the brushes over here to finalize it. And that's it. I will tap apply. And the software will generate a complete dental wax-up for me to deliver and export the dental shells. All right. Oh, and there is another very important, and if you are taking notes, I recommend you guys to take this note. This is very important. When you are printing your dental shells, you have to have a minimum thickness of 0.4 to 0.5 thickness of that dental material, of the dental shell. And the reason why, it's because when you are 3D printing it, if it's less than 0.4 to 0.5 millimeters of thickness, it might break. So in order to get some resistance onto your dental shells, you need to create somewhat like a thick dental shell. How do you check that into the software? You will go over here, advanced. And then we have this feature called the cross section. And the cross section will allow you check the thickness of your dental shell. Okay, so I click here, cross section. I will turn it on. Then I will get my cross section slider. I'm going to place here right in the center of my teeth design. And then I will tap over here, perform cross section. And what will happen? The software will now do a sagittal view of your existing dental wax-up and the patient's intraoral scan. And with that, you will be able to check the thickness of your dental waxing. And that is not only for dental shells, all right? You can perform this type of measurement in any dental wax-up that you are creating with MIFI. This one, I'm just showing it to you guys because it's important that you have proper thickness in your dental shell so it can be properly printed. So over here in pink, I have the dental design that I created. And in orange, I have the patient's existing intraoral scan. I simply tap on measurement, 0.9, that's more than enough. Here I have proper thickness to my dental shell so it can be fully printed without breaking it in the patient's mouth later. So my next step will be to export my dental shells. And how do I export them? I simply go to CAD preset and look over here. We have shells. Most softwares will make you go through a very difficult route for you to create these dental shells. But with MIFI, once you finish your dental wax-up, you can select the type of wax-up that you want and it will automatically generate for you. In this case, we will do the shells. The shells can be 3D printed in 3 pieces where you will get just the centrals and then the laterals and then premolars if you also perform the premolars. That way it's just like easier. You place those shells in pieces, or you can export these models as a one piece, which is how we are going to do it right now. Okay, so as this software is generating the shells, I just got here, oh, it's actually done. But I got here a message from Dr. Rafael. Can I use the shells as temporaries after prep? If I am doing a subtractive case, can I eliminate the part of the original teeth design? So the answer to that, Dr. Rafael, is yes. You can do what we call a digital prep using the MIFI software. Basically, instead of removing, as you could see before, instead of removing the teeth design, you will remove the tooth of the intraoral scan that will be sticking out. Okay, you do that and then you save and export the shells. You prep the patient's teeth and then you can use the shells as well as a temporaries. All right, so it's ready, guys. Over here, no problem. Over here, as you can see, there are 2 ways for you to export your dental shells. One of them is that if you don't have a biocompatible 3D printer and you want to send just these files to your lab, which is extremely cheap for them to 3D print, so it's going to be very low cost for you, you can simply tap export and it will automatically generate that file, and the file is ready to print. All right, just have to place the grids and print. Or if you have one of these 3D printers in your practice, Accurata, NextDent, SprayRay, Desktop Health, Formlabs, Aziga, or FlashForge, you can do you can use our direct connection. That means that you will be creating the 3D design on SmileFy, and then you will click in one of these 3D printers, and this file will go straight into your computer, the Microsoft computer, for you to add it into the printer app and 3D print. So we have this collaboration with these 3D printers. If you do have one of these printers, then I highly recommend you to just connect SmileFy with your 3D printer and do that workflow, because it's just less work. All right. So over here, the files are now exported, or they are 3D printed. And before I go back here to my presentation, I just want to show you how cool it looks. Just gonna remove this as my frame. I'm going to rotate this for you guys to see. You see here the back of it? So that's what we call a dental shell. You see, they are very thin, like veneers that you can 3D print. And when you have the right biocompatible material, these become very strong, and you can even use as provisionals as well. And look how nice it goes here on the margins. Okay. Also notice here that they're all connected to one another, as I explained it to you guys before. Notice here that we have this palatal area, and it's covering the patient palatal area of the tooth, which gives more strength to these provisional veneers as well. And it has its proper thickness. Mine, for example, has 0.9 millimeter. It's very thick, right? But it's for this specific case. But you can define the thickness of your dental wax up. All right, so then I have here another question from Dr. Sam. So how should I support, like how does the printer support this very small file, right? Let me go back here to my presentation, and I will show it to you before I show you how to place it into the patient's mouth. I'm going to go back here once again. This one, I did it with Accurata 3D printer. So when you are receiving this file, you will receive just a file without these grids, right? These grids, you have to do it with your 3D printer software, and that's with any type of 3D printing system. I suggest you to just turn it upside down and place the grids into the inner side of your dental shell. Don't place it on the buccal side, because once you remove it, you will have those little pieces onto the buccal area, and you don't want that. All right. So I recommend you to just place the grids on the palatal area, and in places where it will be easy for you to remove it, and places that are not too fragile. So don't place it here on the very edge, for example, because you might break this printing material because it's very thin. Place it somewhere like in the middle on the inner side. Once you 3D print it, I suggest you not to get a paper towel and just wipe it off, because you could break it. It's very thin. I suggest you to use a spray bottle with alcohol and just spray alcohol over it, and then you just do some dabs over that 3D printed shells before you embed into the alcohol to do the final cleaning and do the final polymerization with your 3D printing system. Okay. So once you finish it, you can do the glazing. You can do final customization with some shades that you want. And then to apply it over the patient's teeth is very simple. All you need is to place a dab of acid gel onto in the center part of the patient's anterior teeth, or posterior teeth as well, but on the buccal side. And then you place a little bit of flowable composite. All right, you could check maybe like the same shade that you used to 3D print the shells. You use the same shade on your flowable composite, and you place a little bit of flowable composite on the inner side to then, oh, I don't have it, to then place it over the patient's teeth. Okay, as you can see over here, you will place them all together. It will kind of like snap in, like it will kind of like pop in to the patient's teeth, because you're using it kind of like as a glove over the patient's teeth. All right, these cannot be used as finals, okay, and that's super important for you guys to understand, because they are all connected to one another, so the patient wouldn't be able to floss that area, but it becomes a great option and a very affordable option for you to do that first, the first stage for the patient's likings. Okay, so once you place that dental wax up into the patient's mouth, you will then be able to take the picture and then, of course, perform the before and after. If the patient is satisfied with that, you can then continue with the treatment that you are proposing with the patient. But the benefit of doing that is that you are not doing it blindly. The patient is not coming into your practice without knowing what's going to happen. You are using a treatment planning tool to guide you, to help the communication with the dental technician, and to help the patient to fully understand the workflow. Once you finalize that stage, you can now move forward to the treatment of your choice. If it's veneers, if it's composite, if it's gingivectomy, if it's any other type of treatment plan that you are creating.